Good evening, everybody. As Dave mentioned, my name is Frank Cammarata, and I am here with
Pati and Guzinski.
And I am the Executive Director of the Erie County Office for People with Disabilities. And Pati Ann
is from the Erie County Department of Public Health Emergency Preparedness, a division of the Erie County Department of Health.
And we are working together. This is actually our fourth or fifth presentation. We have presented for Western New York Independent Living. We've presented for the Blind Association. We've presented for the Developmental Disabilities Association. So hopefully as we continue to do this presentation, we get a little bit better, but you could let us know how we're doing. So we're gonna start this out with the first piece, the first slide. Thank you. If you have any questions throughout, if you don't mind holding them to the end, we're actually asking Dave to actually take a list and then get that list to Dave, and then we'll take that list and we'll get the answers back to Dave as quickly as possible. So if you don't mind holding off on questions, that would be great. Thank you so much. So we're here this evening to talk about points of dispensing and the COVID-19 vaccine that is being provided at this point right now. The COVID vaccine is being provided at points of dispensing, or pods. You may have seen this in the news. You may have read it in the newspaper. A pod is a point of dispensing. Nothing fancy there.
So let's talk about what is a pod. As Frank said, it is a point of dispensing, this time for vaccine. Other times it's for medication or other supplies to any large group of people. And sometimes those pods go under different names, like a dispensing clinic, a medication distribution center. But here in Erie County, we refer to them as points of dispensing. Next slide, please.
And when is a pod activated? Pods are activated when we have a natural disaster. Fortunately for us, we don't have a whole lot of natural disasters like hurricanes or tornadoes or wildfires, but yet we do have infectious outbreaks from time to time, and God forbid, an act of terrorism. Obviously we don't want that to happen, but as you may or may not be aware, we've had infectious disease outbreaks. Here locally, we've had a hepatitis outbreak. We've had an H1N1 outbreak. I'm going to let Pati Ann speak about that.
No, I was going to say you're probably most familiar with hepatitis A in Erie County.
Next slide, please.
So there are different types of pods. We have open pods and closed pods. An open pod are the pods that we have where anybody in the public can come to the pod. This is a little different this time around with the COVID vaccine because you need to make an appointment to get your COVID vaccination. You just can't go to where a pod is and show up and say, I would like my vaccine. And the reason is because all of those appointments are made via Erie County, via the New York State Department of Health. So even though you have to make those appointments, it's still an open pod. The other thing that makes open pods a little bit different this time around is that there are different people who qualify for the vaccine at different times. At first, we had first responders and medical workers who were allowed to get the COVID vaccine. And then it expanded out to include teachers. And then it expanded out to people 75 years of age or older. And then it expanded out to 65 years of age and older. And the pod population depends on who the federal and New York State government say can come to that pod. Erie County does not get to make that decision. We follow the state health department mandates. We also have something that are closed points of dispensing, and those are places that we go to assist that usually vaccinate their own employees, or it could be nursing homes and hospitals. They are their own closed pods. Could be large houses of worship. And we've been doing those at different places, working with different agencies to serve different populations. But that's called a closed pod because not anybody from the public can come, just the people that have registered to be at that location on that day.
One of the things that Patty Ann and I want to point out to everyone is that at this time, the county is operating both open pods at our ECC sites, ECC North and South, and our closed pods we're operating for right now, specifically for people with developmental disabilities. We're operating those with the developmental disability agencies.
To know where the pods will be located, you want to check with local media, and we'll talk about that a little later. But again, just to let you know, you just can't show up at ECC North or ECC South, because depending on the amount of vaccine that we get from the state, depends on how many pods can operate at any given week.
I also want to point out that at this time, you're having, and it can be confusing, understand this can be very confusing. We have pods from Erie County Department of Health. We also have pods being operated by New York State Department of Health. And those are both operating here in Erie County, as well as vaccination sites at local pharmacies. So we're going to be providing numbers for both the Erie County Department of Health to register. We're also going to be providing numbers for New York State Department of Health to register for a vaccine. Next slide, please. So as Patty Ann stated, the question, how will I know about the pods? So your local county Department of Health, Erie County Department of Health, will let you know when and where pods are located. We'll let you know the address, the times, and the dates of the pods. You'll see this and you'll hear this on television, radio, the Erie County website, and Facebook page. And it will also be in the newspapers. So the important thing is really at this time to pay very close attention to local media resources and local media outlets, as well as websites such as the Erie County Department of Health, the New York State Department of Health, the Erie County Office for People with Disabilities, and their respective Facebook pages. That's how the information is going to be disseminated.
If you're joining us from another county, it will probably be very similar. Check with whatever county Department of Health you live in. So if you lived in Niagara County, you would want to check with the Niagara County Department of Health. If you lived in Chautauqua County, you would want to talk with the Chautauqua County Department of Health. Maybe look at their website to find out where their pods are. Every county does it a little bit differently.
Next slide, please.
So when you come to an open pod, who are the people that you see frantically moving back and forth? Who works at these pods? The open pods generally include members of the Department of Health, public health personnel. Here in Erie County, we have personnel from many other departments that are assisting the Department of Health. You may see other first responders assisting, such as EMTs, firefighters, or paramedics. And we have volunteers such as the Medical Reserve Corps members and members of the community emergency response teams.
And Patty Ann, how do you know who these people are, Patty Ann?
Well, you could look at name tags, or you could just ask, or if it's a member of a CERT team, perhaps they're all wearing a certain color shirt that says CERT on it, or you might see people in a red or blue shirt that says SMART. That doesn't refer to our IQ. It stands for the Specialized Medical Assistance Response Team, which is Erie County's Medical Reserve Corps. And so you'll see our volunteers in the pod working alongside the CERT teams.
So there'll be people like you and myself there to assist people who are there to get the vaccine, right?
Correct.
Okay, next slide, please. So when you go into a pod, generally they're very large rooms, but before you get into that very large room, you're going to enter that very large room. There's going to be a greeting section. There's going to be somebody at the door who's going to be greeting and saying hello to you, and they're going to be screening you before you enter. This is to make sure that you have the proper appointment, date, and time, and as well that you are healthy enough to receive the vaccine at that very moment. There's going to be medical evaluation and registration. If something on your form or screening needs more medical information, they may ask you that. I have been at these pods, and part of the registration, you have to bring your registration form with you, or you have to bring your cell phone with you, and there is a QR code that you will have to utilize as you register, and you will have to show that greeter that you have a green check mark to move forward in that line. And as you're going through that line, as you're entering, we are ensuring that everyone is maintaining a good 6-foot distance amongst each other.
So just to clarify a little bit, when you register online for a vaccine, at least this week, because things change, but as of today, when you register, there are 2 forms that you need to fill out. The first form is an eligibility form to make sure that you fall into the categories of people that have been given the green light to come and get a vaccine. So when you fill that form out, if you meet the criteria to come to get the COVID vaccine, you will get a green check mark that will show up on your screen. That green check mark just means that you fit the eligibility category. It does not mean that you have an appointment and that you have registered. And that gets very confusing to people. You now need to go back in and you need to register. And that's where you will answer some of those pre-reviewed medical questions, so that when you come to the pod, we know how to best serve you. When you're done answering those questions, you have to scroll to the bottom of that screen and you have to hit the button that either says enter or submit. When you've done that correctly, you will get another screen that will tell you, congratulations, you've successfully registered for whatever date and time it is. We don't want to have to turn you away at the door because you think your green check means you're registered. And unfortunately, we've had to do that. Next slide, please. So also what happens at the pod? So when you come in, we've asked you to bring some picture ID with you and proof of your appointment, whether it's, as Frank said, whether you've printed it out on a piece of paper or whether it's in your cell phone. So then you will move through the line and you will go sit down at a table, and 2 people will greet you at that table. One person that we call the scribe will be entering your medical information and your demographic information into a very secure system and asking you some questions. And then the person who's going to actually be administering the vaccine will ask you further questions, again, to make sure that you're a good candidate to get that vaccine. And we're going to talk a little bit in the future of this slideshow about who's the best person to help you make, excuse me, make that decision. So when you sit down at that table, sometimes it can be pretty nerve-wracking, particularly if you're a person that doesn't like large crowds or maybe doesn't like to get a shot, which I would say is most people. It's okay to be nervous, and it's okay to say that to those two people sitting in front of you. And if you still have any questions at this point, go ahead and ask them. Those are two really good people to answer any questions you have. So if all of the paperwork is in order and all of your questions look like you're a good candidate for this vaccine, we're going to tell you a little bit about the vaccine, what to expect, and then we will administer the vaccine. After we administer the vaccine, we want to make sure that you're okay for 15 minutes. That is done after any kind of a vaccine. We ask you to wait 15 minutes, whether it's a flu shot, whether it's a hepatitis A vaccine. If you're a little elder in your years, after your shingle shot. After any vaccine, we're asking you to wait 15 minutes. We're not asking you to wait 15 minutes because we think that there's something wrong with this vaccine. It is perfectly normal to be asked to wait for 15 minutes. So when you're sitting in that waiting area, that's another good place to ask questions. Just get one of the staff or volunteers and say, hey, I have a question, and somebody will come and assist you to get you an answer. After your 15 minutes are finished, you'll leave the building through a separate door, and that's just to keep the flow going of the building. Next slide, please.
So understand that these pods are being provided by a governmental entity, whether they be the Erie County governmental entity, the Erie County Department of Health, or the New York State Department of Health. As such, we need to make sure that we are providing reasonable accommodations under Title II of the Americans with Disabilities Act. So we need to make sure that we need to make sure that if you need a reasonable accommodation, you need to reach out and ask us and let us know that you need a reasonable accommodation, and we will be there to assist you. One of those reasonable accommodations that we talk about and we have listed on this slide is service animals. We want people to know that service animals are always welcome at our pods.
No.
Next slide, please.
So some things for you to know before you even get to a pod. Number one, pods are very, very, very noisy. So expect a lot of background noise, particularly if you're wearing hearing assistive devices. It is extremely loud there. We try to provide a quiet area or a quiet corner, but in all reality, sometimes it's not very quiet, or at least not as quiet as we would like it to be. So we would like you to be aware of it. Please be aware that there are a lot of people at a point of dispensing, waiting in lines. So we're going to space people for safety reasons 6 feet apart. There are very bright lights in a pod. At both ECCs, they are held, I believe, in gyms. At ECC North, it's a gym. And so it's those overhead bright sort of educational building facility lights that shine on you. There can also be a lot of scents or odors or smells in a pod. The more people you have, the more scents, odors, and smells that you may have. It may also seem a little rushed when you go to a pod. We can vaccinate somewhere between 800 to 900, sometimes up to 1,000 people a day. We have the capacity to vaccinate. So it might seem to you like we're rushing you. So if at any time you feel like you're rushed and you need us to slow down and you need a little more time, just ask us. Just say, hey, you know what, I need this to slow down. I don't understand, where you want me to go, what you want me to do, and we'd be happy to do that for you. When you come to get a vaccination, there are long lines. If you've been to Disney World or Disneyland, you're used to those lines. I always refer to us sometimes as Vaccination Disney World. because you move through the pod and you stand on an X, and then you hurry up and you move to the next X, and then you hurry up and go to the next X. The only thing we don't have are Disney characters to greet you. You're going to have us. So we will have chairs for people who need them. Again, if you need an accommodation, please let us know. We'll be happy to help you. There are bathrooms. So please try to take notice of those when you come in the door. If they're not obvious to you, again, just ask any of the staff or volunteers and we'd be happy to let you know where the bathrooms are. It can seem very confusing. You're in a big room with a ton of sensory overload coming at you. It is absolutely okay to feel overwhelmed. It is okay to feel nervous. We are happy to help you move through that pod in any way you can. And once again, please, if you need a reasonable accommodation, just ask us. We'd be happy to assist you as best we can.
And to cite an example of something that Pati has done, because you all are aware that the weather has been very, very cold lately. And yes, we have been operating the pods in this very, very cold weather. Pati has noticed people outside, people using mobility devices who've actually been outside and waiting outside in the very cold. And that's not something that we want to have happen. We want to make sure that everyone has an opportunity. We don't want them getting sick. We want them to get that shot, and we want them to get that shot safely. So it's an example of someone just saying, you know what, it's too cold outside. Can I just go inside and wait? And that's an idea of a reasonable accommodation that, yes, we are happy to provide that.
Yeah, and we really do try to move the line along so that nobody's waiting outside in the cold. But we're really happy to do that. If you're there with your parents, if you're there with a friend that perhaps is using a walker and it's just been a long time in line, just ask one of us. We have wheelchairs at every point of dispensing, and we'd be happy to assist you with one of those. Next slide, please.
So again, know before you go. Second page. The temperature may be too warm. It may be too cold. We've touched on that before, right? So please dress for it. Know that we don't want you to be sitting outside. We try to time and schedule the appointments on a very regular basis to make sure that the lines go smoothly. But just in case, dress appropriately. Bring something to keep you busy. If you like to knit, bring your knitting. If you like to read magazines, bring a magazine. Again, service animals are always allowed. If you have trouble reading, and if we're handing something to you and you have trouble reading that, we're happy to read that to you. We're happy to provide those kinds of services. If you need to take a medication or eat at a specific time, please bring these items with you. If you need help with your medication, again, we're happy to help that, okay? But understand that because we are in COVID-19 protocols right now, all water fountains are closed. So please bring a water bottle with you.
So I'd like to talk a little bit about dressing appropriately when you're coming to a vaccination pod. I know that it's cold outside and we've seen some wonderful turtlenecks, but turtlenecks are very difficult to get a vaccination with. So maybe a better way to do that would be to wear a short sleeve shirt and maybe wear a sweater over it or a flannel shirt over it, something that you can easily expose the arm that you wish to have vaccinated. Next slide, please. So one of the questions people frequently ask is, how do I know that this vaccine is safe? How could we possibly have a vaccine made in less than a year and have it be safe? So I thought that was a really good question. So I did a lot of digging into the process. So I'd like to explain how this vaccine came about, any of the vaccines. So the drug company decides, or it works with the government to help put together a vaccine. And they come up with it, and the chemists and the biochemists do their work, and they test in the lab, and they come with a formulation, and all of a sudden somebody goes, aha, eureka, I think I have it. So the drug company must then hold 3 trials, clinical trials, with volunteers of different ages. We always do adults before we do children. And we also include in those trials different ethnicities. These results then are peer reviewed by other scientists. And that's really very, very important. So if you're worried about, you don't trust what the government says about it, you don't trust what the pharmaceutical company says about it, a really good resource would be to go online and just go to Google and type in peer review Moderna vaccine or peer review Pfizer vaccine. And then you can read what other scientists think about the vaccine. And those peer reviews are not in any way, shape, or form swayed by any government entities like the CDC or the FDA. That is a total peer review by other scientists. So the other scientists read the studies, they read the results of those clinical trials, and they make comments, and they have discussions, and they go back and forth with their questions. When the peer reviews are done, the drug company then seeks what's called an emergency use approval. To get the emergency use approval, more independent scientists then review and request the data, and they look it over. Okay, once again, those are independent scientists. Then at this point, the data then goes to the Food and Drug Administration staff, and it goes to the Food and Drug Administration Independent Vaccine Advisory Committee. These are not people that get paid by the Food and Drug Administration. This is an independent vaccine advisory committee. Then, if all looks good, then it goes to the Center for Disease Control, the CDC advisory group, for yet another review. And after that, certain states, and these are usually California and New York, will do another review. And only until all of these steps are completed is that emergency use approval granted. So there has to be a high degree of safety before these vaccines get approved for use. Next slide, please.
So as Patty Ann was talking about the safety, we now talk about risks, because everyone is concerned about the potential risks of getting this vaccine or getting a vaccine. We want to emphasize to everyone on this call that everything in life is a risk. The medications that you take on a daily basis, the vitamins, everything, those all come with warnings. They all come with a certain level of risk. You may have a reaction when you're getting any vaccine. When people get this vaccine after the first dose, they're reporting they're reporting soreness in their arms. Sometimes they have some stiffness. Sometimes they're getting a slight fever after that first vaccine. So yes, there are certain risks, but keep in mind that before you do this, you may want to speak with your personal primary care doctor or somebody who's on a medical care team.
Okay, and a sore arm and stiffness in your arm, slight fever, a headache isn't just unique to the COVID vaccine. That happens with a lot of different vaccines, including your routine vaccine. If you have a tetanus shot, you know how your arm feels for a day or two after a tetanus shot. So those are the basic risks. But the reason I put this slide up here is because there are risks. There's risks that come with every single thing we do. So could you come to a pod and say to me, is there absolutely no risks that I'm taking by getting this vaccine? I can't answer that for you, which is why we're saying to you the best person to ask is your primary care provider. If you go to a community health clinic, ask the staff at the community clinic. Everybody will be happy to assist you to make that decision. Next slide, please. However, there are better sources than others to look for information to help you make this decision. So we want you to be very, very careful where you look online, because there is a lot of misinformation online. We don't want you to go to Dr. Google. We don't want you to talk to Nurse Facebook. Okay? We want you to go to reputable sources of information. We don't want you to just trust anything you read or hear online or see in the news. Okay? You should use multiple sources when you read something. So we want you to go to trustworthy websites and sources of information. And some of those are the CDC, the Center for Disease Control. And some people say to me, well, why should I trust that? That's a government institution. Well, yes, it is, but it is also one of the foremost scientific organizations in the world and is highly well respected. One of the things that I've heard people say is it's so confusing. The CDC says something this week, and then 2 weeks from now, they're saying something different. That's because this is a relatively new virus for all of us. And as we learn things, recommendations change. And yes, sometimes that can be frustrating, but that is a really good source to get the most updated information. You could also go to the National Institute of Health. That is another great source of information. You could go to medical school sites. You could go to the Johns Hopkins Medical School. You could go to the UB Medical School site. And of course, you can always go to the New York State Department of Health or your local or your county Department of Health website. And what we sort of have up there is we have a traffic light up there. And all of those trustworthy websites that we talk about, those would be in the green, like just go to those sites. You know, you might have some other sources. You might say, well, I heard this on, a news channel. Well, now you're kind of in those yellow, that yellow traffic light there. Be careful with that. Just because one news source said it was true, I would check some other news sources and to see what they're saying, and I would go back to a green source to check it. And then you have the red sites. Just stop. Do not even go there. Okay, and that again is Dr. Google. Those are people who say, I've studied this for years. That might even be some of our friends and family members who really mean well, but unless they're scientists or unless they're in the medical field, we really need to go to good sources of information. Next slide, please.
Before you do that, I'm sorry. Actually, I want to point something out because Patti Ann was focusing on the CDC website, and specifically for everybody on this call, I want to point out that if you go to cdc.gov/coronavirus, they have an incredible set of ASL interpreted videos that I strongly recommend. I could also recommend to you that Georgia Tech University, they are going to be putting out a set of ASL interpreted videos as well with regard to the COVID vaccine.
Anything?
I don't know.
I was just asking Frank if NTID had anything on their website, and he said he didn't. He didn't know. Okay, websites that end in .gov or .edu are good sources of information. Websites that are .com, I would take that a little less seriously. I'd be very careful. And on those websites, if anybody is trying to sell you anything that purports to cure coronavirus, don't buy it and leave that website. Next slide, please.
So Patty Ann, I guess David was actually able to get a number of questions from this audience. And so Patty Ann and I reviewed some of the questions. The first question we have is, will we need to get the vaccine every year? Unfortunately, we don't know how long the immunity lasts after you receive the vaccine. Until we have more data on how that vaccine works in real world conditions, we will not know. Understand this is, as Patty Ann said, this is a brand new vaccine. And this is the very first time, we've ever seen COVID-19. So this is all very scientific right now, and everyone is learning. So right now, we don't know how long the immunity is going to last. And that is all as per the CDC.
Yep. Yes, all of the answers that we're going to give you here were taken right from CDC data.
Next slide.
So the next slide, will I have to get the vaccine? So a couple of points. Getting a vaccine is a very personal choice. It is always your choice to get a vaccine or not get a vaccine, like it is for any other medical procedure. And once again, we're going to remind you that the best person to help you make that decision is your medical healthcare team or your primary care provider. Keep in mind that we want to get as many people vaccinated as we can so that we can move through this. And we're going to talk a little bit more about this in an upcoming slide. Even if you get the vaccine, keep in mind we're still going to need to stay apart physically. We're going to need to distance, and we're going to need to wear masks until enough of us have gotten that immunity, either through being vaccinated or having had COVID. Keep in mind that some of the vaccines are a two-shot series. So we know that one of the things that are happening is we all sort of have corona fatigue at this moment. Everybody wants this to be done. Everybody's tired of wearing masks. When is life going to get back to normal? We understand those frustrations because we feel them on any given day, and we share in the coronavirus fatigue. But we are so close. When you look back to where we were a year ago from today, we really didn't even know what was coming. And here we are a year later, and we have some very remarkable vaccines that have been created and that do very well in protecting us all. So we just need to have a little more patience and be smart, keep our distance, wear those masks, perhaps 2 masks, depending on who you are and where you're going. And wash your hands and use some hand sanitizer and stay home when you don't need to be out. Next slide, please.
The next question. So what is herd immunity? I've heard a lot about herd immunity, but I don't know what that means. Are we talking about cattle? No, we're talking about herd immunity, meaning how many people need to get the vaccine before we are all protected? And again, the experts don't yet know. I know that we've heard in the news, there's some people are saying we need to have 65% of the population, we need to have 70% of the population. We do not know the exact number right now. So as many of you on this call who have an opportunity to get the vaccine, if you can get the vaccine, we strongly recommend that. The more people who get the vaccine, the quicker we'll get to that herd immunity, and the greater possibility we will get to that herd immunity.
Next slide, please. So I thought this was a great question. Who pays for this vaccine? Well, you do. I do. We all pay for this vaccine. The doses were purchased with taxpayer dollars, and they're going to be given to all Americans at no cost. However, the vaccine providers can charge what's called an administration fee to give somebody the shot. And that usually is reimbursed by your public or private healthcare insurance. They're not charging you for the vaccine because that's free, you paid for it. It's an administrative cost. It's the cost of whatever needs to happen in that physician's office or that healthcare clinic to give you that shot. So what happens if you don't have any insurance? There are quite a lot of us in the US that don't have a lot of insurance. Well, first thing we want you to know is that nobody will be denied a vaccine if you're unable to pay that administration fee. It'll be covered by something called the Health Resources and Services Administration Provider Relief Fund. This vaccine is free to every American. We already paid for it. Again, a provider can charge an administration fee that will be reimbursed by public or private healthcare insurance. So we don't want you to say, no, I'm not going to get a vaccine because I don't have any health insurance. We don't want that to be the barrier that keeps you from getting this vaccine. Next slide, please.
The next question, if I had COVID-19, do I still need a vaccine? I'm going to let Patti Ann do this because she's the one from the health department.
So the answer to that is absolutely. So if you were treated for COVID-19, let's say you got a test and you were positive for COVID-19 and you went and you were treated with monoclonal antibodies, big words there, big money right there, or convalescent plasma, you'll be asked to wait 90 days before getting the COVID vaccine. If you've had COVID-19, right now we're still asking you to wait 90 days before you get the vaccine. Okay, if you didn't get any treatment, you still wait 90 days to give your immune system some time to recover. Again, this recommendation may change in the future when we learn more about this disease and how the vaccines work, or it may not. Again, that's one of the things that's frustrating about this disease is that we're still learning as we go. But right now, we're going to ask you to wait 90 days. And when you go to a point of dispensing, the screener will also ask you some other questions about, have you had any other immunizations, or lots of other questions that may have to do with your medical condition. Again, those questions are all to make sure that you're a good candidate to safely receive the vaccine. Next slide, please.
So question number 6, somebody asked, what is in the vaccine? That is a very, very scientific question. And I actually went to the cdc.gov website. And believe it or not, they do have information on what is in the specifically the Moderna vaccine and what is in the Pfizer vaccine. But to be honest with you, I can't tell you, and I strongly recommend that you just go to the cdc.gov coronavirus website for those very specifics. And that will give you an idea of what is in each of the vaccines and what is the difference between each of those vaccines.
Yep, Frank, it's not that Frank doesn't want to tell you, and it's not that I don't want to tell you, it's just that, wow, we looked at the ingredients in those vaccines and we both went, wow, okay, I think we should give them the website to go and read. And if they have more questions, they can ask their physician about those. There's a really good breakdown of what's in every single vaccine, including all those ingredients that everybody worries about. You know, is there latex in the vial? Well, the answer to that is no, there is not. So you don't need to worry about that. Is there mercury in the vaccine? Well, no, there's not. So you don't need to worry about that. But you can go on that website and you can look at every single ingredient in that vaccine and have fun trying to pronounce it at the same time. Next slide, please. So the next question is, will there be a vaccine passport?
And as Patti Ann and I know that we like to travel. I know that we've been wanting to travel now for quite some time. And there's been a lot of talk about a vaccine passport. Other countries are talking about a vaccine passport. The media outlets are talking about it, but at this time, there is no confirmation from official government sources that there is a vaccine passport. But that, again, is going to be one of the things that you're going to want to go to cdc.gov, New York State Department of Health.gov, Erie.gov, and you're going to get that information from those sources.
This is also a good slide to remind you that when you come for your vaccine and you come for your second shot, either 21 days later if it's Pfizer or 28 days later if it's Moderna, bring your smartphone with you and take a picture of your vaccination card, because that is part of your medical record. And if you lose that card, then you'll have a picture of it on your phone and you can get a new card. What we don't want you to do with that card is post a picture of it on Facebook. When you come to the points of dispensing, we have a fun little selfie area that you can stand in front of, and you can be proud that you got this vaccine, and you can take a selfie there safely because it doesn't contain any information about you. The minute you post your vaccine card online, on social media, and remember, it only takes seconds for somebody to grab that screenshot. They now have your name and your birth date and a way to get all kinds of personal information. So please don't post a picture of your vaccine card. Come on in, get your vaccine, and afterwards take a selfie at our little COVID vaccine selfie area. Next slide, please. Okay, one of the questions was, does having COVID-19 affect for the hearing loss? And when I saw this question, I thought it was a very good question, and yet I wondered why somebody asked it. And in doing some research, there was a gentleman in Great Britain, and you can read about this in the medical journal, who experienced some hearing loss. Keep in mind that that is one person out of millions of people who have gotten the vaccine. So you can go to the medical journals, you can read about that. But overall, the research shows that hearing loss is not a common symptom of COVID-19 infection, nor is it considered a common complication. What you most likely will see is a loss of, in some people, smell and taste, not hearing loss. However, if you are positive for COVID-19, and even if you're not positive for COVID-19 and you suddenly experience hearing loss that you haven't had before, you need to seek prompt medical care. Speak to your audiologist, speak to whomever it is that can assist you with that. Once again, please remember that that was one person out of millions of people who've gotten this vaccine. Next slide, please.
The next question, do both doses of the vaccine need to be from the same manufacturer? The answer to that is an emphatic yes. The clinical trials that were conducted by each manufacturer, clinical trials were conducted by each manufacturer using their own vaccine. Results may vary if they're mixed. We don't want that to happen. And experts do not know if they should be mixed. So we need to make sure that if you receive the Moderna the first time, you get the Moderna the second time. If you get the Pfizer vaccine the first time, you get the Pfizer vaccine the second time. And when Pati, Aine, and I say Moderna and Pfizer, it's because those are the two vaccines that are available in our community right now.
Okay, remember, went back a few slides ago, excuse me, when we were talking about clinical trials. Pfizer did their own clinical trials on their vaccine. Moderna did their own clinical trials on Moderna. There was no mixed trial in there. So you need to stick with the same vaccine for both doses.
And you need to make sure that you are getting both vaccines.
Yes, please, and we'll talk a little bit.
2 doses of the same vaccine,
2 doses,
I'm sorry.
yes, 2 doses of the vaccine. Please don't sign up for the first vaccine knowing that you're not going to come and get the second one or or you can't make it in those days. We want you to look at your calendar. We want you to say, this is an important vaccine for myself and my community. I'm going to make the time when I'm eligible to come and get this vaccine because it's important for me to take care of myself and the people that I care about.
How many days do we need for the Pfizer vaccine?
It's 21 days and 28 days for Moderna. And when you come to get your first shot, by the way, in Erie County, and I would imagine that it might be the same in other counties, we will help you register for your second dose before you even leave the post-vaccine waiting area, which is another reason, if you have a smartphone or an iPad, bring it with you so that we can help you make that appointment. Next slide, please. So what are some of the side effects of the COVID-19 vaccine? Well, before we review this, let me remind you that we're all different. We all have individual immune systems. So you might have a completely different reaction than anybody else in your family or your friend. But some of the common side effects are in the arm in which you get the vaccine, and you get to choose which arm you want your vaccine in, are pain at the injection site, some swelling, some redness, a rash on the arm that you got the vaccine in, and stiffness in your vaccination arm. So if you sleep on your left side, maybe that's not the arm you want to get the vaccine in. Okay, some of the signs and symptoms throughout the rest of your body, you might be fatigued, tired, you might have chills, you might run a fever, you might have a headache, your joints might be a little bit achy, but that's just you. Somebody else might not have any of those side effects. It just depends on your immune system. Next slide, please. So what are you going to do about these side effects? Well, anytime you get a vaccine, you can use a cool, wet washcloth over the vaccination site. You don't want to use an ice pack directly on your skin because you don't want to get frostbite. And then you want to use or exercise your arm, kind of move it around. Maybe you don't want to go lifting weights that day, but you want to exercise your arm. We'd like you to drink plenty of fluids, and please remember that alcoholic beverages do not count when we say drink plenty of fluids. And we're talking about water, milk, juices, maybe some Gatorade. Water really is the best one to drink. Okay, dress in layers to stay cool or warm as necessary. After the second vaccine, some people will say, wow, I just sweat all night. I was so hot, I just couldn't cool off. Some of us just couldn't warm up for anything, no matter how many layers we had on. So just dress in layers to try to be as comfortable as you can. And just know that, discomfort for a slight fever or pain is normal. Okay, plan to stay home the day after your second vaccine. There is a 50-50 chance that you will have some signs and symptoms. Again, not everybody gets them, but after your second vaccine, you want to give yourself lots of tender, loving care because you might feel like you have the flu if you experience those symptoms. You might be tempted to say, oh my goodness, I'm going to take some Tylenol or I'm going to take some ibuprofen, whatever it is. Try to ride it out. If you can, try to let your immune system do its job. Talk to your medical provider before you get your vaccine and say, you know what, I'm getting my first vaccine today, and a month from now, I'm going to get, or 3 weeks from now, I'm going to get my second vaccine. Is it okay for me to take something for the fever? Again, you have to discuss that with your physician. Okay, next slide, please. So when do you contact the doctor? How do you know if this is a normal side effect or if something is really going on? So here are some basic guidelines. Okay, if the redness or the tenderness in the arm where you got your shot starts to increase significantly after 24 hours, you might want to give your healthcare provider a call. Okay, if the side effects are truly worrying you, or you don't seem to be getting better after a few days, you might want to talk to your healthcare provider. Some people, you know, they feel better in 12 hours and they're up and they're chipper and they're ready to go. Some people took 24 to 48 hours. Some people got better slowly. Some people said it was like I flipped a switch and I felt completely different. So it, again, everybody's an individual. That will vary for each of us. If you think at any time you might be having a severe allergic reaction, your tongue feels thick, it's starting to tingle, you're having trouble breathing. If this happens after leaving the vaccination site or any time after getting the vaccine, you want to seek immediate care by calling 911. Next slide, please.
The next question, how do I make an appointment if I can't do it online? So as we said in the beginning of this, remember that there are two different ways to make appointments. You may make an appointment with New York State Department of Health. You may make an appointment with Erie County Department of Health. And we have the numbers listed above. For vaccine appointments for the New York State Department of Health, the New York State vaccine appointment line is 1-833-697-4829. And if you would like information from the New York State Department of Health regarding the COVID vaccine or COVID information, New York State Department of Health offers a COVID information line, and that is 1-888-364-3065. Keep in mind, those two numbers are for the New York State Department of Health. For Erie County Department of Health, the number has been and remains 4 questions and to request a vaccine, the 858-2929 number. Next slide, please.
So who can you talk to make sure that this vaccine is safe for you? So maybe you're a little nervous about the side effects. Maybe you're just nervous in general because this vaccine, got put together so quickly, even after all of the explanations that we've shared with you. You know what? It's an excellent question. You should always question what's going to go in your body. That's an okay question. The best person to talk to about the safety of any medication or any vaccine is your primary care provider and your medical care team. Why are they the best folks? Because they know your medical conditions, they know your medical history, they also know the potential risks, and they can help you make the best choice for yourself. Don't let anybody else make this decision for you. It's always your choice. It's up to you. I personally decided that it was a really good choice to make for myself, the people I cared about, my family, my friends, and my community.
So it's very frustrating. I know the information that we gave you, it is very complicated. Believe it or not, it's frustrating for all of us too. We are doing our best to make sure that the information that we're getting out to you is up to date as possible, and it is the best information that we can provide. Understand that it's okay to be scared, confused, it's okay to be skeptical. Very importantly, it's okay to ask questions, and it's very okay to be frustrated. There's a lot of people who are frustrated right now, who are asking a lot of questions. There's a lot of questions to be asked. We are also asking questions too, because unfortunately there's a lot of unknowns and things are moving very, very, very fast. We need to make sure that we get information out to you, and we need to make sure that that information that we get out to you is as accurate as possible.
However, I would like to point out that there's a big difference between being skeptical and spreading stories and theories and conspiracy theories about the vaccine that are completely unfounded. Once again, check that website, .gov.edu. Make sure it's from a reputable source. We want you to make a really well-informed decision. And when you share people's theories or personal opinions, it really doesn't help any of us make the best choices for ourselves and our community. So it's okay to be a little skeptical. It's okay to ask questions, but it's not okay to share disinformation and misinformation either in person or online. And there certainly is a lot of that going around on the internet. So please be careful where you get your sources, and please yourself don't become an inadvertent source of misinformation. Next slide, please. So as we said in the beginning, that all of the information that we presented in this program this evening was taken from the Center for Disease Control websites. It's an easy one to remember, cdc.gov. There are all kinds of resources on that page. There's all kinds of information about other diseases on that page if you have questions about other things. It's a great source of information, much better than Dr. Google.
And remember, they have the ASL videos on there.
So we're here to answer any questions. We have our number up there. You can always call Frank at his office. And Frank, what's the number?
It is 858-6233.
You can try my office, but Frank's office is a little better at this time because I'm out at Pods, but it's 858-7109. If we can't answer your question, we will find somebody who can.
So David just asked the question, will there be Wi-Fi for your phones and iPads at the Pods?
We try to have hotspots. However, sometimes we're at the mercy of the way a building is built. Please keep in mind that we're in gyms, concrete structures, don't exactly have the best Wi-Fi access, but we'll try to assist you with that. So if you have one of those MiFi spots on your phone, that's a great thing to be with you.
Will clear mask, David asks, will clear masks be available for those who are deaf, hard of hearing, who need to read lips?
Well, I am so glad that you asked that question. Yes, we do have clear masks for the staff to utilize at the pod. And I'm very happy to say that with a lot of help from the folks at DAS and folks who are deaf and hard of hearing in the community gave us lots of insight, and we were finally able to find clear masks so that we could be better able to assist you. They still get foggy though, but we do our best.
So as Dave is saying at the bottom there, please, if you have any questions, send them to Dave at communications at WNYDAS.org, and Dave will forward those questions to us, and then we would be more than happy to get those answers out to Dave and back out to you. Hopefully this has been informative. We hope that you have questions for us, and we hope to see you at the pod. And when you get to the pod, do not hesitate in asking questions.
We would also like to thank DAS, St. Mary's School for the Deaf, everybody who is deaf and hard of hearing for helping us be better public servants at the Department of Health to serve you better during this emergency pandemic. You've given us invaluable input, and we look forward to getting more from you. So thank you for being partners in this endeavor.
And I have to double and triple agree with Patti Ann. The assistance that Deaf Access Services has provided us throughout this pandemic has been second to none, especially serving the deaf and hard of hearing community. And I know that Patti Ann and I have learned a great deal from all of you. So we cannot say thank you. And I as the director of the Office for People with Disabilities, cannot say thank you enough to the interpreters who work with our county executive on a weekly basis when he does his interpreting for his press briefings. They are doing an amazing job, and we have Karen on the picture right now. I know I'm not supposed to thank Karen, but I'm going to anyway because she is an amazing person.
I'll bet that the interpreters could get their own like YouTube channels or their own Twitter accounts and have all kinds of great following on them at this point. So thank you very much for assisting us. We really appreciate it. And thank you again to DAS for being such great partners.
Take care, everyone.
Good
Be
night.
safe. Please wear a mask.
Wash your hands.
Wash your hands and use a lot of hand sanitizer.
6 feet.
Bye-bye.
Good night, all.
Thank you, everyone. If you have any questions, email us here at communications@wnyda.org. I will be happy to pass that along to Erie County and get more information for all of you. Hope this presentation was informative for everyone. You got some more answers to your questions, and be safe. Stay safe and hang in there. Hopefully it's all over. Take care. Have a great upcoming weekend.